let me introduce Professor Vinita Lal. So as I was discussing, there was a internet disconnection at my end. So Professor Vinita Lal, I hope I am audible now. Thank you, ma'am.
Yes.
Thank you. Thank you. I'm sorry for this. So there was an internet disconnection at my end. So Professor Vinita Lal is a very renowned researcher. She has written many research papers, including the role of globalization on rural market, sociological study in Western UP. It is in an interdisciplinary referred research journal Jigyasa at Banaras Hindu University. She has also published various other research papers on globalization and education, etc. She was a speaker on women's rights at ICICI Skill Development in Lucknow. She has also published a book like E-Globalization, like Globalization and Indian Villages and Social Changes and Social Control. So I invite Professor Vinita Lal. Professor Lal, the time is yours.
Thank you, sir. Thank you, organization. Good morning to all of you, respected chair, dear audience. I'm very thank you to AIBM conference to inviting me as a keynote speaker. I think am I audible? Can you hear me?
Yes, ma'am.
Please, anybody respond me. Can you hear me? Okay. Without taking so much time, I'm going to share my slide because I have only 20 minutes. Okay.
Yes, ma'am, it is shown. Yes, yes,
Okay.
ma'am, it is there.
So my presentation title is Health Evolution in the Post-Corona Virus Pandemic. Everyone know health is a vital aspect of human existence. It comprising various dimensions like physical, mental, social well-being, and it denote a condition characterized by holistic well-being encompassing surpassing the mere absence of disease or impairment. My study will explore the significance of health and its diverse nature, primarily you can say the maintaining physical health necessity, the corporation of regular physical exercise, a balance.
Ma'am, just request you to kindly slide show your slides so that it is in the full screen, ma'am.
Okay, let me. Now it is okay? No. Just to give a time. So, the development of a strong and resilient physical constitution not only has a positive impact on individuals' overall well-being and enjoyment of life, but also serve to mitigate the likelihood of the developing chronic illness, ultimately leading to extended duration of existence. So mental well-being hold equal importance encompassing emotional and psychological health, and it influence over the cognitive processes, emotional states, and behavior pattern. So the presence of sound mental enable individual to proficiency, navigate stress, foster positive interpersonal connections, and exercise judicious decision-making ability. So in contrast, individual with the comprised mental well-being, and it may encounter a range of difficulties like anxiety, depression, and sometimes even substance abuse furthermore. Social health highlight the importance of interpersonal relationship and social support network. It established the cultivating strong relationship with one's family, friends, and communities are the key component of achieving a fulfilling existence. So these indicators provide individual with emotional supports of feeling of inclusion and chance for the growth. So in the present day, it is characterized by rapid societal advancement, attaining a state of balance across uh, several facets of well-being, and it can pose the significant challenges. So failing to consider any aspect can have an effect in total welfare. So it is imperative for individual to prioritize their health by adopting healthy habits and requesting assistance when needed and engaging self-care practice. So the COVID pandemic, which originated in 2019, and had a significant global influence encompassing a range of area, including society, politics, economic, healthcare in the multiple nations. And the previous occurrence were several accounts. This is a acute respiratory syndrome and Middle East respiratory syndrome. Additionally, have been other viral outbreaks such as Zika virus, Ebola virus in the past 10 years. So there is a growing recognition that infection disease should be considered as a prominent health menace that will persistently challenge in the foreseeable future. So the COVID-19 has functioned as a mean of accessing the readiness of the healthcare system in multiple areas. The special focus on their level of the preparedness and the findings indicated that effectiveness of the public health surveillance system and the adequacy of existing infra were not uniformly excellent. So healthcare system have difficulty in simulating and managing abrupt and continuous surges in the workload, particularly within the acute care environment, and not withstanding the existence of contingency plans. Healthcare system appeared inadequately prepared to address the sudden and substantial increase in demand. So, from policy perspective, the consequences of delay in prompt decision making, such as implementation of lockdown measure, it can have substantial impact on the subsequent healthcare outcome from an epidemiological standpoint. So the COVID-19 has acted as a catalyst and it expediting the implementation of alteration in the public health initiative. The aforementioned development have given rise to novel healthcare delivery paradigm, and that prioritize preventive intervention remote care area. So this is all my secondary data sources, and some review literature are here. Research material is totally secondary database because time is very. So I'm going to come to discussion. My pandemic as a catalyst, I have told you. The second is a shifting large of the patients to remote area. Yes, the mental health care field has also witnessed this phenomena where the COVID pandemic has served as a catalyst for the integration of online therapy, health technology into regular practices. So this development follow a numerous attempts over the course of more than 2 decades, and it is characterized by combination of noteworthy efforts and predominantly unsuccessful outcome. So the prevailing imperative in the profession, such as assertion that the establishment of clinician-patient therapeutic bond, it can occur through face-to-face interaction and are currently being addressed despite evidence suggesting. So it is probable that mental health care institution, upon acquiring the capacity to provide service to their patients through various digital technologies in the aftermath of the COVID-19 pandemic, it would have limited incentive to relinquish these capabilities given the benefit they observe throughout the extended duration of the crisis management. So it is anticipated that the forthcoming blended approach will arise where a e-mental health solution will assume more prominent role within the ordinary services, and furthermore the existing knowledge and skill can be applied to enhance the implementation of more comprehensive e-mental health strategy for the general population. So this approach would evolve not just guided intervention, but also entirely self-directed interventions such as self-help application, online therapeutic modules. So the feasibility of implementing the later approach in the setting and the nation with limited mental health resource where the demand for the such service has been recognized, it should be examined and perhaps implemented as a favorable long-term outcome following the COVID-19 pandemic. And remote care or telehealth service have been employed in the service healthcare context, including the emergency crisis and routine care. So my next point is improve emphasis on surveillance system and data analysis. Yes, the swift worldwide dissemination of SARS-CoV-2 highlight the persistence of need of creating reliable and inclusive surveillance and system for infectious illness. So public health surveillance for infectious illnesses dependent on the collection of positive test results from the designated clinical laboratories or laboratory network in order to track the occurrence of specific pathogenic microorganism within a particular population. So the current endeavor to optimize public health spending has led to consolidation of multiple clinical microbiology laboratories and result the tradition toward the laboratory integration. So the process of consolidation has resulted in the establishment of operational framework in which significant centralized clinical laboratories and do most duties on the central platform. So therefore, it is imperative to consistently employ big data and artificial intelligence technique from the purpose of the modeling crisis as well as identification and comprehension of weakness inside current system in nearly instantaneous manner. So the utilization of mobile technology has been prevalent in successfully overseeing individual in the quarantine and tracing possibly exposed individual inside certain region or countries, and as demonstrated experience of South Africa and Taiwan. So these revolutionary technology are anticipated to have growing significant in the realm of public health, facilitating out our understanding of the complex and the interrelated global landscape. So in order to implement the many changes in the strategy, and it is necessary to enhance public awareness pertaining to healthcare system. So as well as improve the technologies available and their potential use effectively managing outbreak of infectious illness. The third one is a development of legislative. This is a COVID-19 has expedited numerous process, yet several problems continue to endure and the consent had a range of topics including but not limited to credentialing, licensing payment, as well as different issues pertaining. So in order to further explore the ethical dimensions and adopt perspective, so it is very important to consider the acquisition of you can say it is a like acquisition and ability of vast amount of personal data, such as those obtained through geotag social network, and these renders the practice of total data anonymization. The third one is the development of political. So further broad population viewpoint, the exclusive reliance of anonymous data to safe privacy of data providers may hinder the optimal functioning of system and the compromising of idea of accountability. As a result, openness is the reason for this. So in this context of contagious disease, the utilization of anonymous information of a paramount importance. So a prominent characteristic of ongoing pandemic is a very remarkable proliferation of misinformation, conspiracy theories, and rumor pertaining to COVID-19, and it is disseminated among the general populace and through various social media platforms. And these has several effects on our endeavor to address the prevailing epidemic, both in immediate and the extended duration. So the proliferation of the disinformation during the pandemic may be attributed in the attributed in the widespread. It is a very proactive debunking of the unsuccessful for the COVID-19 and being marketed on the internet platform and the social media. So social media site act in the response of proliferation of fraudulent posts, either by removing them entirely or by flagging them with the assistance of fast fact checker. So there has been a significant surge in the quantity of English language fast check during the period from January to March. And within increase of the 90%, this surge has outpaced the existing resource dedicated to fast checking. So it is extremely probable that the dissemination of information has occurred at more accelerated rate. So the next is one I would like to highlight. COVID-19 pandemic, where specific understanding it is characterized by uncertainty, and the adoption of precautionary principle is widely regarded as a rational approach to ensuring the protection of public safety. And it is anticipated that COVID-19 pandemic, there will be critical examination of numerous measures in terms of their temporal appropriateness and efficacy. So this scrutiny will encompass the assessment of whether the measure and their execution were commensurate with the level of danger, as well as evaluation of legal appraisal made based on the scan. The next one is the development of communication technology-based approach, which is very important because it breakthrough in the communication machine learning and transportation play a very crucial role in driving the progress of healthcare and the expansion of medical care telehealth coverage during the pandemic. It signify a very notable advantage step. It enhanced the ability of healthcare treatment for those with chronic neurological conditions within their immediate region. So the adoption of new remote service in the healthcare has raised security concern, as evidenced by the phenomena of Zoom bombing, and these concerns impact both patients and healthcare providers. So therefore, it is a very crucial that technology-driven methodology prioritize the safeguarding of participant privacy by implementing requisites. And the post-COVID-19 age has brought a fourth realization that a significant proportion of the healthcare service, and it can improve through the utilization of technological breakthrough and certain services, and it can equally effective when administrative remotely. So in some scenario, post-operative monitoring, telephone consultation have found to be as effective as in-person visits, demonstrating similar patient satisfaction level and rate of complication or adverse events. So next one is the development of financial methods model to support scientific risk and crisis preparedness. As COVID-19 had a dual impact on laboratory medicine efforts and result in different outcomes. Like microbiology department have observed substantial rise in diagnostic workload, and it is a result in patients who are suspected for being afflicted with the COVID-19. And conversely, non-COVID-19 related operation conducted in the clinical laboratories, such as cancer services, experience a significant decline and necessitated the implementation of remote service model for adoption. So comparable scenario transpired inside a institutional and hospital setting where there was a decline in regular activity, hence requiring the redistribution of the personal and resources. So this pandemic has resulted in a significant alteration to healthcare begins model to fundamental academic health science, public health, surveillance, and the industry, and the utilization of informal network, which encompasses a clinical laboratory serving a consortium of hospitals, academic groups, and test manufacture has instrument in the Europe response to the this pandemic. So the result of their expedition, mobilization, and prompt reaction to clinical demand, it is very likely that additional worldwide endeavor akin to those operating within the innovative medicines And this initiative framework will augment it, and with the objective of safeguarding a diverse area of inventing methodologies. So the imperative of confront the COVID-19 problem prompted significant healthcare provider to respond promptly and frequently without the chance in depth deliberation regarding the corresponding financial implication. So it is indeniable that the magnitude of the investment needed to address the challenge posted by posed by the COVID-19, and it is ambitious and warrant careful attention in the near term. So it is a imperative to build new public-private collaboration encompassing the domain of medicine development, vaccine production, diagnostic testing, and in also scientific research, collaboration, and preparedness for the crisis. And it is very crucial to implement novel financial models that prioritize the facilitation of the additional sources of the funding, acknowledge the significance of delivering financial return to capital provider, and establish the sustainable development. Now to the conclusion. Because time is, I think, going to. So the significance of proactive healthcare emergency and you can say health emergency and a strengthened dedication to global public health preparedness is shown by COVID-19. It is very imperative to consider the insight gained from the constant observed in the current healthcare system addressing infectious disease outbreak in the 21st century, and this will facilitate an inviting of the transformed health landscape. And moreover, it is a very imperative knowledge that the use of you can say use of technologically enhanced solution, and it demonstrated efficacy and should be incorporated as an essential component of the regular healthcare protocol, and the attainment of the optimal outcome needs the active engagement of the both patient and healthcare providers. So, however, endeavor require the careful consideration and the resolution of ethical and regulatory and legal issues that have emerged in the context of ongoing epidemic. Current crisis has provided the foundation for the significant health transition in the aftermath of the COVID-19 pandemic, and it enhancing the preparedness of the healthcare system address future global in coming 21st or 20 coming century. Okay, thank you.
Thank you, Professor Vinita. I think, first of all, congratulations to you for such a wonderful research. Professor Vinita spoke about public health, about social health, and the changes which we are seeing after a pandemic, which was COVID-19. Professor Vinita also explained us how big data, how mobile technologies are changing and affecting the way we look at our problems now, especially the health problems. There are ethical dimensions also, which Professor Vinita touched. And she also showed how uncertain things are when we are changing, when we are living in this changing world. Now I open the floor for questions. You can ask question, you can raise your hand. Anyone who's raising hand, I'll ask them to put their question and ask their question. You can also write your question on the chat box. So I'll read the question for on behalf of you to Professor Vinita. So anyone who's asking questions, please raise your hand or write in the chat box. Professor Vinita, before these questions start coming, I would like to have your opinion on the future. How, because obviously the world is changing, as you said, and even the healthcare is changing. But my question here is that the technologies are also changing very fast. Like we see a lot of change in artificial intelligence. We see a lot of change in big data. So how do you feel that can the healthcare system keep the pace with this changing technology and things which are changing? And in the meanwhile, I'll ask others also to keep their questions ready. Professor Vinita.
Okay, sir. Look, machines and artificial intelligence are revolutionizing healthcare industry by analyzing anything, detecting disease pattern and predicting outcomes. And these technology can automate tasks such as diagnosing illness and suggesting treatment. So it can be very helpful.
Okay. I think that will be the positive side of artificial intelligence, which we
Right,
are all
right.
looking for. And maybe this is how it is going to change our life in a very, very
Yes.
better way. Okay, so thank you, Professor Vinita, for taking your time and giving such a wonderful insight in the area of healthcare and the changing world.